Welcome everybody to the 101 podcast by Serena Organics, where we help provide accurate and reliable information around cannabidiol, also known as CBD. We will be meeting with a number of industry leaders to help provide educational content to you, our audience. Today we'll be talking about the rise of CBD within the growing UK market and the use of medicinal cannabis. Today I'm really excited to invite our guest on. He is a consultant neurologist, medicinal cannabis expert, and he was in fact one of the first doctors to actually prescribe medicinal cannabis through the government within the UK. Really excited to have our guest on today. His name is Professor Mike Barnes. Mike, thank you for joining us today, and how are you doing?
Good. Thank you very much. It's good to be here.
It's great to have you, Mike, and thank you so much for joining us. I'm really excited for our audience to hear a bit more about your background and the work you're currently doing within the medicinal cannabis space. On that, I want to dive straight in. Could we start with your role within the industry itself and how you actually became one of the lead medicinal cannabis experts within the UK today?
Yeah, that's a long tale, since it goes back about 20 years now. As you've said already, I'm a neurologist, and I was working with multiple sclerosis people, and they were beginning to come to the clinics, NHS clinics in Newcastle, where I live, and saying they were using cannabis, and it was helping pain and muscle spasticity in particular. Mm-hmm. So I just asked those coming to the clinic if they'd used it, and about 50% had, or were still using cannabis when 20 plus years ago, because it was very illegal. They were criminalising themselves to do so I thought there must be something in this plant. Otherwise, half of the population of MS people in Newcastle wouldn't be using it. Mm-hmm. And around the same time as it happens, I was asked by GW Pharma to become a little bit involved in the development of what turned out to be the first licensed cannabis medicine called Sativex, which is 50%, broadly speaking, 50% CBD and 50% THC in a spray, and it's licensed for the management of spasticity and multiple sclerosis, hence my involvement. Mm-hmm. And that became licensed somewhere around 20 years ago now. It wasn't particularly well used in the UK because NICE, in its wisdom, said it wasn't cost effective. It was too expensive for its benefits, and probably that was true. But it went on to be a very successful licensed medication in many other countries around the world. So after that, there was a sort of lull for maybe 10 years when there was not much cannabis research done in the UK, and certainly not much used outside of the illegal market. And then I was asked really out of the blue in 2016 to do a report for the All-Party Parliamentary Group on Drug Policy Reform, chaired by Baroness Meacher. Mm-hmm. And we did that. I did that review of the efficacy of cannabis and its side effects across the spectrum, outside neurology, into psychiatry and gastroenterology and cancer and such like. I did that with my daughter Jenny, who's a psychologist. She did the side effect profile and the relevance of schizophrenia and such like, and I did some of the rest. And that sort of propelled me a little bit into the limelight, because that hadn't been done before to that detail. And then a little bit after that, I was approached through an organisation called Endar Pain that was working with Hannah to get a license for her son Alfie. So I then helped get that license from the Home Office, which turned out to be the first cannabis prescription license in the UK, and that was given out in June 18. And very quickly, the media campaign that I was involved with then, with Endar Pain and with others and with Hannah, was a very successful campaign, because the government, in the space of 5 months, changed its mind from cannabis being of no value whatsoever, a Schedule 1 drug, which by definition it means it's of no medicinal value, to actually licensing it and moving to Schedule 2, which means it does have medicinal value. And that campaign was purely driven by the media, which were virtually all on the side of Alfie, if you like. Yeah. And the media campaign changed the government's mind, and credit to them. They changed the law in November 2018, and I think they did very well with the law change, actually, because they allowed cannabis to be prescribed for any medical condition, there's no limit. I think they made a mistake that it's only prescribable by doctors on the specialist register, that's hospital consultants, not GPs. I think that was an error. Mm-hmm. But other than that, it was a very good law change. The problem is that wasn't the end of the story, it was almost just the beginning of the story, because since then there's not been one cannabis product being prescribed on the National Health Service. There's only 2 in the whole country, Alfie and another child in Northern Ireland, who were pre-law change. So post-law change, there's been none prescribed.
Wow, okay.
And that's our main focus of our campaign now, is really twofold: to get the NHS to prescribe, because it's been very reluctant. We can explore the reasons perhaps in a moment. And also to develop a UK cannabis industry, because at the moment it's all imported, which has COVID has brought into focus the problems of an import-only industry. So that's what we're working on at the moment, through media, lobbying, consultancy business, helping companies develop their products in the UK, from abroad and from within the UK, both CBD, the legal over-the-counter CBD, as well as medicinal cannabis. Excellent. So that's, in a brief summary, perhaps not so brief, what I'm doing at the moment.
Fantastic, and thank you for that, Mike. I think it's excellent to see the work you guys are putting around driving medicinal cannabis into the NHS. It sounds like you guys have had a bit of a slow slog in terms of getting the ball rolling there, but it sounds like you're making really, really good progress, which is great. For our listeners who don't necessarily understand much around medicinal cannabis, obviously there's a big stigma still associated for those who know about cannabis through recreational use. How would you explain the main differences, should we say, between medicinal cannabis to that of someone who uses cannabis recreationally?
Well, cannabis recreationally, socially, spiritually is the same plant. Let's make that clear. It's exactly the same species, if you like. Cannabis sativa, and there's a couple of others as well. The main difference, though, is that generally speaking, street cannabis is high in THC. THC is the stuff that's psychoactive. It makes you high, intoxicated, whatever word you want to use, and that's why people buy it. So the stuff on the street is generally very high in THC and very low in everything else. Everything else being the 100 or so cannabinoids, including CBD and other minor cannabinoids, so-called, most of which don't have a psychoactive effect. So medicinal cannabis can be relatively high in THC, because THC is very good for medicinal purposes, particularly for pain. But generally, the medicinal variety is high in the other main cannabinoid called CBD, cannabidiol, which is not intoxicating, not psychoactive, and indeed it counteracts the psychoactivity of THC. If you take that example I mentioned earlier of Sativex, that's 50% THC and 50% CBD. So you'd think that will get you high, 50% THC. It doesn't, because it's counteracted by the 50% CBD. Okay. So generally, if you prescribe cannabis, you'd start with a high CBD product, where it's low in THC, and that works for some people, for some conditions. You then move up the ladder, if you like, to a more balanced product, and you might end up with a higher THC product, but you always got that CBD in it. So generally, not always, but generally, you don't get high from medicinal cannabis. Okay. And of course, the medicinal prescribed cannabis, you get the guarantee of the quality and the consistency. It hasn't got heavy metals in it, it hasn't got pesticides in it, it hasn't got mold in it that you can get from the street variety. You don't know where it's come from, you don't know quite what's in it. So you get consistency and safety through medicinal prescribed cannabis. That's the other main difference.
And how do they measure the levels of CBD and THC in the medicinal cannabis that they're actually prescribing to patients?
It's a bit of a mess at the moment. Some quote percentages, and then people say, well, percentage of what? Personally, and mainly for the medicinal cannabis use, I think the bottle should say what's in it, and it should be milligrams. We work as doctors, we tend to work in milligrams. In smaller children, milligrams per kilogram, to give you a sort of baseline. But take, for example, CBD, the anti-anxiety effect of CBD, roughly is 60 to 100 milligrams of CBD. Okay. So I'd like to see a more consistent labelling with these products, even if they're over-the-counter products, the legal CBD market that says how many milligrams per mil or milligrams per spray or milligrams per capsule, whatever format it's in, because I find the percentage way of documenting it is very muddling.
I agree entirely, Mike. To give an example, at Serena Organics, we actually put the percentage, but we also put the total mg, and in addition we actually put the amount of mg per drop you'll be having, for example, in the tinctures. Whereas I know some products in the past may not have been entirely accurate in terms of the level of percentage or mg they're quoting on the labels.
At the moment in the CBD space, what's on the label is not necessarily what's in the bottle. Exactly. About a third of the time. It varies a bit. And that's why I think we did need some control in the market to say, well, you can guarantee more consistency and the safety, and what's on the label is what's in the bottle. We needed that regulation, I suppose. I think, though, the government and the novel food implications we might talk about in a minute have taken a sort of proverbial sledgehammer to crack a nut and gone far too far in terms of trying to control the industry.
Yeah, I guess on that point of the novel food applications, then, Mike, how do you see the industry changing once the novel food application comes in as of March 2021? The regulators obviously want a lot of details and documents around how the industry is being managed. How do you see that unfolding with the regulators throughout the next year?
I wish I knew. I wish the regulators knew, because it's incredibly muddled. At the moment, they said that if you're going to make a novel food application, that means that it's not been seen in the EU as a food after, I forget the exact date, 19-something, 70-something. If it hasn't been used before that, then you've got to make an application called a novel food application, which costs a lot of money. Figures vary, but I've heard it's at least £100,000 to get this application. And of course, there's lots of really good quality, high quality CBD companies who can no way can they afford £100,000 in investment like that. So effectively, what this will do is put the industry not into decline. Whether it decimates it is perhaps a little strong, but it will certainly really have a major negative impact on industry. Just at the time after COVID, where we want industry, we want employment, we want tax revenue, and I think it's a great shame that the Food Standards Agency, with support of a couple of, I think, inappropriate bodies like the Association of the Cannabis Industry, have gone far too far to control and put, if you like, what they're pushing is pushing big cannabis, like in a similar way to big pharma or big alcohol or big tobacco. And what we don't want to see in the cannabis industry is big cannabis dominated by a few big players.
Of course.
That reduces the quality, reduces the range you can get, and cannabis is a highly individual, very personalised product, very personalised medicine. And the last thing you want is half a dozen big players producing poor quality product. You want a diversity in the industry, and the current regulations, I think, will put an end to that.
I couldn't agree more, Mike, and I think where we are nowadays compared to where we were before, it's a huge difference. I think there's a lot better products in the market now to say maybe even a year ago, where products were stating to have X amount of CBD, and then they'll be tested and there'll be zero trace. And given where we are as an economy, they're talking about potential recession. If the regulators decided come March 2021, but they wanted to remove a number of high quality products off the shelf, I think that would be a massive shame.
There's a glimmer of light, and the EU has backed off, but they've backed off only to potentially call CBD a narcotic and put it through the narcotic regulations, which is just, was no word for it really other than plain daft. I mean, CBD is not a narcotic, full stop. And if some bureaucratic lawyer somewhere has determined that that's the definition, then they need to change their mind about the definition. But we're not in the EU, or won't be after December, so what we do, whether we abandon the whole thing or push it down the novel food or push it down the narcotics route, I don't know. I don't think they know yet. Let's hope that some sort of common sense prevails, and the government can say, well, we want a new industry, we want it's a brand new industry, a lot of jobs potentially, a lot of good for a lot of people, and a lot of tax income. Let's be sensible about this.
Couldn't agree more, Mike. And I think given the state of where we are as an economy right now, it doesn't make sense for regulators to start taking CBD products off the shelves, especially when they're wellness products, which are good for the state of mind, good for mental clarity, and actually help people who are currently experiencing a lockdown. I'm on the topic of THC and CBD, as you touched on earlier. For our audience who don't know much about them, now they are both cannabinoids, as you rightly said. Just two of actually over 100 of cannabinoids found in the cannabis plant. Both interact via our endocannabinoid system. I guess there's question marks for some people around, does CBD make me high? Does THC get me high? Could you share a little bit of light on both the effects of CBD and THC and how they interact with our bodies?
It's largely how they work, not totally, but we all have. Every animal in the world with a vertebrae has an endocannabinoid system. That means that we produce ourselves cannabis-like natural compounds. The main ones are called anandamide and 2-AG, and they link with cannabis receptors in the brain and the spine and indeed throughout the body. And what these do when that chemical links with that receptor is they have an overarching control of all the nerve function in the body. It's a remarkable system where people may have heard of neurotransmitters that are responsible for chemicals, that are responsible for transmitting an impulse from one nerve to the next nerve. Mm-hmm. There's several of them, a dozen or more of them. Some, for example, people probably heard of dopamine, which is the one that's deficient when you get Parkinson's disease. There's others called serotonin, which are involved in depression. Opioids, people have all heard of. So all these neurotransmitters that have different functions, different nerves, are all, if you like, controlled or modulated by the endocannabinoid system. It's a major, called homeostasis system. It's a major system that produces balance throughout the body. So the endocannabinoid system is this master balancer, if you like, of all bodily functions. And all cannabis, external plant cannabis, phytocannabinoids as they're called, all they do is interact with our own body's endocannabinoid system, and they help modulate it, they help adapt it, they supplement it, and that's how it works. And when you know that, then you realise why cannabis has such a huge range of potential benefits. Bowel function, from Crohn's disease at one end to anxiety at the other end to epilepsy, to pain. People will say, well, you can't do all that because we're used to single molecule medicines doing one job. But when you know how it works, then you realise why cannabis has potentially such a huge range of benefits and potential in medicine. It doesn't. Cannabis, plant cannabis, the phytocannabinoids don't just work through the endocannabinoid system, but they largely work through it. And put it simply, CBD and THC bind to varying degrees with these receptors and have an effect on just supplementing and adding to our own endocannabinoid system. That's how they work.
And in terms of CBD and THC, do they have different effects on the things you mentioned, like Parkinson's or pain relief?
There's some overlap. I mean, CBD has a painkilling effect, and THC has a more potent painkilling effect. So they're both painkillers. But there are some other differences. CBD is largely anti-anxiety. It calms people down, whereas THC by itself in high doses can have the opposite effect. Epilepsy, CBD is largely the anti-epileptic component, but again, it's not as simple as that. Some children particularly need a little bit of THC added into the regime. So it's a very interesting component because sometimes a low dose of one of the cannabinoids can have an opposite effect from a high dose. So it is very personalised, it's more of an art form, cannabis medicine, than a scientific form, if you like. But it can be remarkably helpful for many, many conditions.
You guys have been fundamental really to driving change within the UK in terms of medicinal cannabis. I know it's much more developed in the US and Canada, but it sounds like you guys are doing excellent campaign work to really drive prescriptions, especially for medicinal cannabis within the UK. That said, is there a lot of research currently ongoing into the effects of CBD specifically for health conditions, or the effects for medicinal cannabis and the benefits that it can provide for various different health conditions?
Yeah, I mean, it was difficult to do cannabis research when it was an illegal product. You could get a license. GW Pharma succeeded in their license, for example, for its two products, but it was very difficult, and the fundamental research was difficult. You had to give a special Home Office license to handle the plant. There was work done. To put a number on it, when I did the work for the All-Party Parliamentary Group 4 years ago, there was something like 20,000 references for cannabis medically.
Wow, okay.
In the last 4 years, that's doubled. So it was the whole of medical history up to 2016 has now doubled in the last 4 years. So now it's legal It's in 50 countries it's legal, medically at least. It's much easier to do the research, and therefore relatively rapidly we're getting better quality studies on all sorts of conditions. A lot of, for example, research recently has been on autism. A lot more work done on epilepsy. Refinements, and we know it's been painkilling for a long time, but refinements of that, what's the best ratio, what's the best way of giving it. So all those things we need to understand as a proper medicine, as a doctor prescribing it, we're beginning to learn fairly rapidly now. If you want to, the trouble with some of our regulatory bodies like NICE is they just look at double-blind, placebo-controlled studies. That's a classic pharmaceutical way of looking at things. So you give a pill to a patient, neither you nor the patient knows what it is, whether it's a proper thing or placebo. And that's a perfectly good way of doing research for cannabis as well, but it's mainly for single molecule pharmaceutical products, and cannabis doesn't really lend itself to that. And the problem we've had is that the regulatory bodies like NICE have only tried to look upon it as a pharmaceutical product. There was not enough double-blind, placebo-controlled evidence, therefore we can't approve it. But actually, if they look at it as a plant, there is endless evidence that it's pain-killing, endless evidence that it's anticonvulsant, endless evidence it's anti-anxiety. So they need to look at that more widely than they traditionally have done. So more work to be done, absolutely more work. There'll be, there's lots more cannabinoids we need to look at. There's 133 at the last count, I think. We know a lot about 2, a bit more about another 5 or 6, and virtually nothing about the other 120. And the terpenes we shouldn't forget. The thing that gives cannabis its smell, they have medical properties. The flavonoids that give it its colour have medical properties. We'll be looking at the cannabis plant for decades to come and learning about it. So we're not there. But there's a lot of evidence now. Let's prescribe it and learn as we go along.
You mentioned terpenes there, Mike. Just on that note, for our listeners who don't necessarily know much about terpenes and their involvement with cannabis, how do they interact differently with our bodies compared to that of CBD and THC? And what are the potential benefits they have?
Some work through the same endocannabinoid system. One particular one called beta-caryophyllene. Acts a little bit like THC. Others, we don't quite know how they work, but we know they have medical properties. Myrcene is a very common one that is probably promotes some sedation. When we've got a better market in the UK, we'll be able to prescribe a cannabis product that has high in myrcene, but is useful for people who sleep badly or want to be a bit sedated in the evening, a bit calmer. There's others like linalool, which is another terpene, has anticonvulsant effects. Exactly how they work is not clear for most of them, but they do work, which is why when you give someone cannabis, a proper full-spectrum cannabis product, you're giving them a huge range of cannabinoids, large number of different terpenes, and a large number of flavonoids, and they all interact together, and the whole plant is clearly better than individual components, which is why I'm very against isolates. You can get an isolated CBD, and that does a job, but it does a better job if you use the whole plant with all that rich mixture of all those other cannabinoids and terpenes. So that's called the entourage effect, and I'm a great believer in that. And we get a better result from providing a full plant product.
And that's a good point, Mike. I guess the entourage effect is much more specific to medicinal cannabis. For those in our audience who are looking for non-psychoactive aspects, they'll be looking more for that CBD isolate, which will still give them a lot of benefits. But for those medical conditions where that combination of the full spectrum of terpenes to THC to CBD is useful, then yes, definitely you want that entourage effect for sure. Is there a lot of research going into that at the moment?
Yes, and again, not enough yet. I think if we did this again in a year or 2 years and 5 years, we'd be hugely more advanced about what's the best combination, what's the best way of doing things, what's the best way to deliver it, what's the best dose. We're a little bit working in the dark to an extent at the moment. But we shouldn't be apologetic about the evidence that's out there now. There's tons of evidence out there now, and that's what's wrong about NICE and the other higher medical authorities that have said there's not evidence to use this, which is just rubbish.
And what are you guys doing at the moment to help drive that change with the likes of NICE and other regulators out there that are responsible for medicinal cannabis?
It's mainly through media campaign. We have had a meeting with NICE. They say they might consider revising their recommendations. I believe that when I see it. We're mainly doing media work, like this podcast. We get a lot of articles in the press. We're trying to push, trying to get it more available, really, and try to overcome. If we can overcome the negativity of the medical profession, that's the key. Actually, a lot of people complain about the government, and it's partly true. The government could have done more in the first place and can still do more, but actually the barrier now is the medical profession. And another focus that we have is education of the doctors, because they don't know anything about it. It's not a criticism, they've never been taught.
They don't learn this.
They don't learn it. Yeah. So why should they? And you wouldn't want them to prescribe when they didn't know about something. So another focus is teaching the doctors who don't understand it's not a dangerous medicine. It's not right for everybody, don't get me wrong. It's people who shouldn't be prescribed it. But generally it's good quality, it's safe, and doctors need to know more about it. And once they know more about it, I think they'll be much happier to prescribe it. And then we need some doctors in the National Health Service to say, this is the right thing for my patient, I want to use this, and overcome the barriers that do exist in the hospital hierarchy. So we can't get you prescribed that, it's against the NICE guidelines. And I think doctors should act in the best interest of their patients rather than the best interest of their career or the best interest of their hospital employers.
And that's a good point for any medical professionals listening within our audience today. You guys are doing great work driving change with your campaigns, but a lot of this will also come from people working within the healthcare profession themselves. So the likes of doctors who see the benefits of CBD and medicinal cannabis and actually step forward and say, yes, we want to try this, and really drive that change.
There are people who want to prescribe, but have been stopped from doing so in the National Health Service. I think there's a few doctors who need a bit of courage of their convictions and get on and say, this is the right thing, I'm going to do it.
Do you think the stigma of cannabis is putting them off at the moment?
Yeah, sadly, the campaigns dating back now to the 20s and 30s were remarkably effective. They were very good media campaigns because they managed to persuade everyone that cannabis is nasty and dangerous and drives everyone psychotic. And, there's still a little bit of that in the ether, particularly from some newspapers like the Mail on Sunday, to name just one. But, there's still a lot of stigma attached to it. And this has been, an anti-establishment dangerous product used by hippies and stoners for years on end, and it can't possibly be any good to anybody. And that's quite inbuilt in the psyche, particularly the psyche of the white middle-class male medical hierarchy.
And I think a big problem is the way in which recreational cannabis is majority consumed. Most people tend to smoke it, and I think therefore a lot of people, when they hear medicinal cannabis, they think, okay, I'm going to have to use the same method, which could necessarily be bad for my health, when in fact there's many other ways you can consume medicinal cannabis, get all the benefits without any of the health risks.
Yeah, and that's another myth. We can't actually prescribe a joint. Smoking is illegal still. We can smoke a vape, but people need to understand you can actually take it as a capsule, so it's just like any other medicine. Spray, capsule, oils are the most commonly prescribed. Edibles as well can be prescribed, actually. I don't think anyone has yet. And vaping is a much safer way than smoking anyway. And about 50% of prescriptions are now for vaped flower, interestingly, and 50% for oils.
Interesting. And everything going as you expect over the next, say, 3 to 4 years, Mike, how do you see the medicinal cannabis and CBD industry changing?
Well, I hope some sense will prevail for the over-the-counter CBD industry. I hope, perhaps I'm wishful thinking here, but I think it's a great mistake that the CBD companies can't make medical claims. It clearly is a medicine. But we have to sort of cover it up by saying it's a wellness product. I can say, let's just be honest here and say, does it help anxiety? Yes, it does, let's say so. And we've got to get out of this pharmaceuticalising the whole thing. So I'd like to see that break down. I'd like to see the quality come up as well, sure. But really what I'd like to see is two things. One is the NHS beginning to prescribe, because it's been the private sector. It's a shame it's only in the private sector because it's quite expensive. Many people can't afford it. There's been 1,000 prescriptions, roughly, written in the private sector now. I think that's great. That's from January, so it's progress. But when you think there's 1.3 million people who use cannabis for medical purposes in this country every day, 1,000 being legally prescribed, that's 1.29, whatever it is, million who are still criminalising themselves to get a decent medicine.
So, NHS we need a UK industry so we get around these supply chain issues that have been a real problem in COVID. So we need some farmers there are in the UK who want high THC cultivation licenses. Let's help them get it. The Home Office should help them get it. I'm not saying they're abstracting them, but it's not easy to get their licence. So let's see a bit of a change of attitude from the government. Let's embrace a new industry and earn money from it from the government's point of view. I never thought I'd actually say that, but that was one way of doing it, and give employment as well as giving health benefits to tens of thousands of people.
You see it's been widely accepted across many different European countries in terms of legalising cannabis. You see a massive shift in terms of the number of countries that are now allowing prescriptions and allowing the legalisation of recreational cannabis. I think it's the time for the UK to actually step up and catch up with the rest of Europe.
We're lagging well behind. It's time the government woke up to the benefits of cannabis and the safety of cannabis. And listen to the 85% of the population are behind medical cannabis. And if you had a free vote now, it's probably just about 50%. I think the latest thing I heard in London was that 65% of the London population were pro-legalising cannabis.
Wow, okay.
Roughly 50% of the country. I mean, just listen to the population, listen to the doctors, just talking about medical cannabis now. Let's get on and prescribe it, and let's not be so backward.
Well, hopefully they open their ears, shall we say, and take notes, especially with people like yourself, Mike, and Hannah, who've been driving these campaigns. I think it's excellent work you guys have been doing, and I really want to see that come to fruition. And you're right around health benefits. We've got to be careful at Serena Organics about what we claim CBD can do for people, although we know what the health benefits are. Because it's not classified yet, we can't actually say this will fundamentally do that and this will fundamentally help you this way. So we have to be very careful about how we position it, and it's more on the wellness and well-being side rather than this will definitely help you with this condition.
And okay, we can't do that under the Medicines Act. You can't claim a medicine unless it's gone through all the medical hoops. But let's change that then. Let's look, it's a botanical. It's a safe product. Let's just be able to say, with all the proper caveats, that the right product for the right person, this does help your anxiety, this does help your sleep, this does improve your appetite. Let's just say it. It's honest.
And I think without that, that's why people aren't getting educated, because they don't understand how CBD and medicinal cannabis can help them with things like anxiety, with things like stress, with things like sleep, until there's proper research that goes into the actual health benefits. Just before I let you go, Mike, I follow you on a lot of various platforms and see the research and the content that you do share around the latest developments within CBD and medicinal cannabis. Just for our audience, where can they follow you? Where's the best platforms to follow you on?
I work now largely with Hannah, who's Alfie's mother, Hannah Deacon, and we have a consultancy together called Maple Tree. And we can follow that on Twitter, mapletreeconsultants.co.uk, and that's the best way to find us. And we're happy to talk to people, and if we can help with any project, we're happy to do so. I
would also personally recommend your LinkedIn, Mike. I think you share some great content on there.
Thank you for helping promote my that I'd forgotten about. Yeah. What else have I forgotten about? I'm on Twitter. I've got a web page, Maple Tree Consultants, and LinkedIn.
Oh yes, your web page is excellent. I definitely recommend the audience to check that out as well as Maple Tree Consultants. Well, Mike, thank you very much for coming in. I really appreciate you joining us today, and I know you've shared some great content which no doubt our audience will learn a lot from. So thank you very much.
Thanks very much.
Cheers.